Good morning, and thank you all for participating in today's media briefing. This is our 37th since the start of the pandemic. We continue to hold briefings as part of UPMC's ongoing commitment to provide timely and accurate information. Today I'm joined by Tammy Minier, UPMC's Chief Quality and Operational Excellence Officer, Dr. Stanley Marks, Chairman of the UPMC Hillman Cancer Center, and Dr. Don Yealy, UPMC's Chief Medical Officer. They will provide an update on Omicron in the communities we serve and provide more information on Evusheld, which we give to prevent COVID-19 in patients with immune-compromising conditions. After their remarks, we'll take your questions. Dr. Yealy.
Thank you very much, Paul, and thank you all for attending today. As we've seen over the past week, COVID-19 infections and hospitalizations are decreasing or they've plateaued across the nation. This includes in all the communities that UPMC serves. The Omicron variant came quickly, and like we saw in other areas around the globe, it is dropping fast after very intense activity. The virus still has the ability to harm, and it remains in our communities today. We still don't know what the future holds with COVID-19 infections and serious illnesses in our regions, or what life after Omicron might look like. But there's reason for optimism. No matter what happens, the fundamental of managing the pandemic remains the same, and we've shared this with you throughout the entire pandemic. This is not the time to let up. We have said this before, and I say it again right now. We may be finished with the pandemic because of our fatigue about it, but the pandemic is not finished with us yet. Mitigation efforts like masking and vaccination against COVID-19 are still the most effective ways to protect yourself and all those around you from serious illness. Even though the trends are going the right way, hospitalizations are still higher than they've been for 19 out of the past 22 months. The good news is that the Omicron variant appears to cause less severe symptoms than the Delta variant before it, particularly in people who have been vaccinated and get infected. However, this variant, the Omicron variant, is exceptionally transmissible, and it really still can cause severe disease in unvaccinated people and in those who are most vulnerable, particularly those that are immunocompromised. Let me hit this again. Vaccination reduces dramatically your risk of severe illness, your risk of hospitalization, your risk of death, and something that is true before is even more true now with Omicron. Don't let someone else's mild experience with Omicron give you a false sense of security. If you are not vaccinated, this virus can and often does cause severe illness in people who are unvaccinated. We see that unvaccinated people who are under 60 years old are 9 times more likely to be hospitalized, and they're 14 times more likely to die. More than 75% of our current hospitalized COVID-19 patients are not fully vaccinated. The remaining are almost all immunocompromised. It tells the story of the benefit of vaccination. For the past 2 years, our healthcare workers have been there serving the communities. They stand with us to serve you right now when you need care. We ask that you trust us when we say you can protect yourself and you can protect the people around you by wearing your mask and getting the COVID-19 vaccination. Get a booster when you're eligible too. If you get sick, stay home and get tested.
Thank you, Dr. Yealy. In addition to asking everyone in our communities to get their COVID vaccines and their boosters and to continue to use their masks, I have an update on a medication we first told you about last month called Evusheld. This is actually 2 monoclonal antibodies that we give before someone is infected with COVID-19. It lasts in their body for many months, and is ready to stop the virus. It is given through an intramuscular injection, just like a vaccine. And like a vaccine, it protects you from very serious illness. We are giving Evusheld to our patients whose immune systems are not working properly, or we refer to as immunosuppressed. These patients are at the greatest risk for very serious outcomes if they get infected with COVID-19. These are primarily patients who are either immunosuppressed from an underlying disease or taking immunosuppressive medication, such as patients who have had an organ transplant or have a connective tissue disease like lupus or rheumatoid arthritis, as well as some cancers where their immune system is depleted. These also include patients with blood cancers, in particular like leukemia, lymphoma, and multiple myeloma, who lack the ability to always make antibodies to vaccination. And finally, members of our community with HIV or AIDS or other illnesses where their immune system is significantly compromised. Evusheld is not a substitute for vaccination. Even if you are immunocompromised or in one of the categories I mentioned, you should still get all of the vaccinations as well as the boosters. To my physician colleagues, please speak with your patients who are immunocompromised now. Please tell them about Evusheld and answer their questions they might have so they will understand how important this treatment is for them and be ready to get it as soon as it might be available for them to receive. I want to end with a story about Evusheld that actually sticks with me. One of my patients who is being treated for lymphoma dutifully received all of his 3 vaccinations that I had recommended, but unfortunately, he could not make any antibodies to the COVID-19. He was doing everything possible to minimize his exposure. Well, his daughter got engaged, and he was very concerned about her upcoming wedding. I advised him that he should not participate, particularly because it was an enclosed environment and many attending would be unmasked. Then Evusheld became available, and we offered Evusheld to my patient, and I recommended that he definitely get it. And while Evusheld would not completely eliminate his risk of getting COVID, it certainly significantly diminished it. I'm happy to say that he was able to walk his daughter down the aisle. And this is what this preventive medication does. It allows our patients to participate in life's most important moments.
Thank you, Dr. Marks, for what a wonderful story regarding your patient. Because the supply of Evusheld is limited, we are working hard to be able to get the word out about this very important drug and make sure we get it to the people who need it the most and to distribute this in obviously the fairest way possible. We have a knowledgeable team calling patients in our communities who are eligible, answering questions, and scheduling appointments. So how do you recognize if you get one of these calls? Well, it starts with an automated message that says, "Hello, this is UPMC calling to share information from your doctor about Evusheld," followed by an explanation of what it is. You will then be asked to press 1 if you believe you qualify, and you will be called to schedule an appointment. Within a few days after that, someone from UPMC will call you back to schedule you for a location close to your home. We offer it here in Pittsburgh, but we also offer it in Erie, Williamsport, Harrisburg, Lidditz, York, Mechanicsburg, Altoona, and Chautauqua. So just about everywhere we go. I hope you'll press 1, really. But if you aren't ready, and when you get the call, please talk to your doctor. They can refer you, and if you miss the call, don't worry. We're going to leave a number for you to call back so that you are able to still have access to this critical medication. Just last week, one of our nurse leaders at UPMC Passivant, who had been invaluable throughout the pandemic, she has worked tirelessly caring for many, accompanied her 69-year-old mother to one of our Evusheld clinics. Betsy's mom has rheumatoid arthritis, which is a painful condition where your immune system attacks your joints and other parts of your body. We give patients like Betsy's mom a medication that stops their immune system from doing this, but also prevents them from responding well to COVID-19 vaccinations. And often our rheumatoid arthritis patients are older, so they are particularly vulnerable to the complications from the virus. For the past 2 years, while Betsy has been caring for our COVID-19 patients in our emergency department and treating them with monoclonal antibody clinics, she's been worried about her mom, just like many of us are. When Betsy's mom got the call for Evusheld, she, of course, asked her nurse daughter, "What should I do?" And what do you think Betsy said? "Mom, call them back and say you'll take it. I'll take you to your appointment." So Betsy and her mom smiled and laughed through the entire appointment. Afterwards, Betsy said that she had prayed for this and is just so proud of her mom and the example she set. I can't say how proud I am of Betsy for all of the wonderful work she's provided in caring for our patients at UPMC and now actually helping her mother continue to be safe. If you or a loved one gets a call like Betsy's mom, please take advantage of this powerful way to protect yourself from COVID-19. In the meantime, if you think you might be eligible and have questions, please contact your physician or specialist to find out more. You can also go to upmc.com, COVID-19 prevention antibodies, to read about Evusheld. It's stories like this that warm our heart, that keep us all going. As you've heard from Dr. Yealy, we all may be done with this virus, but our teams are not. Our teams have stayed in the game here at UPMC, caring for us, caring for our mothers, our brothers, our sisters, our cousins, no matter what. They have continued to give their all, day in and day out. And as a leader, I often wonder, how else can I support them? How else can we support them as members of our community and the incredible caregivers that we have at UPMC? It's doing what we're doing right now, and it's asking all of you to please continue to wear your mask, get your vaccine. If you get a call about Evusheld, say yes. It's these strategies and working together and caring for each other that are going to allow us to walk forward from this pandemic.
Okay. Thank you all. And now we'll take some questions from the media. To ask a question, please go to the participants icon at the bottom of the page and press the Raise Your Hand button. That will put you in our queue. I will read your name and we'll unmute your line for you, but please make sure to unmute your line on your end as well. We'll try to call on as many different outlets as we can in the time we have allotted. So again, please go to the participants icon at the bottom of the page and press the Raise Your Hand button, and we will put you into our queue. I have a question here for Tammy, I suppose. Is there a cost for Evusheld?
There is no cost to individuals for the medication itself. The government supplies it for free. But there typically is a cost to administer the medication, and it is a covered benefit by the UPMC health plan and many other insurers. But cost-sharing requirements may apply, depending on an individual's specific policy. If you think you may be eligible for Evusheld, you should just check with your insurer. And they can clarify what cost-sharing requirements may apply so that you have all the information you need to make that decision.
Thank you. Let's go to Nicole Brambilla from the Lancaster News Online. Nicole, please go ahead.
Thank you so much for taking my question. I'm kind of curious. The Department of Health released statewide data showing that post-vaccinations since January 1st, 2021, overall about 16%. But if you just look at since August going through October, that they represent about 31%. I was hoping to get a reaction to that and the fact that overall breakthrough cases I just recently had one myself, even though I'm vaccinated and boosted, are up. Is this all because of the Omicron?
Well, that's an excellent question. Thank you very much for asking. And I think it highlights one of the common points that's easy to misunderstand. Vaccinations are there to make sure that your body is best prepared if you come in contact with the virus or develop an infection. It's not there to prevent infections, at least in an individual. Perhaps over time, there'll be less and less virus activity as more and more people are vaccinated, but that's not the primary goal. The goal, once you met the primary series and then got boosted, was to have an immune system that is ready to fight off the vaccination. And obviously, there are more people who have had primary vaccination series than there are that have had primary vaccinations plus a booster. The latter continues to rise over the last few months. What we know is that if you're primarily vaccinated, and especially if you're boosted, you have a much lower chance of serious illness requiring intensive care or having a bad outcome, including death. And that reminds us that vaccination and starting the path and making sure you followed it as much as possible is what matters the most. Yes, across our communities, there's many people who either haven't started the path yet or have the opportunity to get the booster. We continue to educate about that, to make it available. UPMC has given over 770,000 doses of vaccines, and we'll continue to do that as long as our communities need that.
Thank you, Don. Let's go to Liz Kilmer at WPXI. Liz, please go ahead.
Hi, thanks so much for taking my question. Could you just break down a little bit of information about the availability, how many doses you have, if you can, how many you've already provided and hope to provide in the coming weeks? And then just second, could you talk a little bit about the efficacy or the success with Omicron specifically as it pertains to Omicron?
Sure. Thanks for asking those details. So we have given approximately 1,000 doses of Evusheld already. We just received a larger supply, and so we are looking to continue to see those numbers grow in the coming weeks. As it relates to the overall drug's effectiveness with the various versions of the virus, we are obviously following the ongoing evidence. But yes, at this point in time, it's very much our belief and support that the Evusheld drug works very well in stimulating antibodies against all forms of the virus right now.
Dr. Marks?
I'll just add to that the folks that have received Evusheld that I'm taking care of have done very well. There aren't any side effects, and it seems very effective at preventing COVID-19 onset.
It's key to point out one more time, vaccines are still the most basic and most effective way to help protect yourself if you come in contact with COVID-19. Both vaccines and Evusheld will not put up a force field around you, but they'll allow you to fight off any contact you have with the virus. So it's not that we wouldn't expect someone to turn positive after either one of those things. What we expect is that your immune system will be much more ready, and you will have a mild, if not an asymptomatic, experience with it. It's kind of early yet to know with Omicron because we've only been using Evusheld for a few weeks. But my expectation will be that it'll provide protection that is much better than not having the Evusheld.
Thank you. Next question, Tom Lehman at WGAL-TV in York and Lancaster. Tom, please go ahead.
Hi, this question's for Donald. Can you talk about how the trends we've been seeing regarding cases and hospitalizations have been trending as far as the UPMC system is concerned? And then I know we are expecting some kind of update from the state today on efforts to try and assist with capacity. And I'm wondering if you might be able to talk about, just the impact that nursing home patients can have as you guys try to treat as many people as possible within the capacity limits you have.
Two excellent sets of questions. So first, you asked about the trends with COVID-19 in our communities and our hospitals. Our peak looks to have been both in the communities and in the hospitals probably about 10 days ago, and we're rapidly coming off that peak. Now, having said that, the amount of activity in our communities and in the hospitals, in other words, people who need hospital care, is still fairly high. It's higher than it has been for most of the pandemic. So we're clearly not out of the woods yet, but I do see positive signs. We know that both in South Africa, where Omicron was first noted and clinical experiences were, that rapid, intense uprising in activity, both in the community and the hospital, followed by a quick decline, happened, and we're experiencing that here right now. We're not completely done with it yet. I can't predict what will happen in the future. What I know is that we will respond to the needs in our communities, both for health care and for ongoing protection and advice. We've been doing that throughout. You also asked about capacity, which is a twofold question. Capacity is, can we take care of you when you need it? And the answer very simply is, yes, we can. Has our ability to do that been challenged over times? Of course it has been. There have been many more people who need it for COVID-19, others who need it for all the usual health care that we've been familiar with for years, some of which got put off during the pandemic. So the demand has been up, and our workforce has been under challenges for the better part of 2 years. We've been able to meet all of those challenges by engaging with our workforce, thinking smartly about how we staff, where we staff, and working together with many others, including those in the Commonwealth. You mentioned that the Commonwealth recently announced activities to help support our healthcare workers. We are fully supportive of that. We had been engaged with conversations with the Commonwealth and the Department of Health, and we think this is smart. Our healthcare workers are the essence of providing care. It's not about buildings. It's not about other things. It's about the people who care for you. We'll continue to do that. We will partner together with our workers and with those across the state to make sure that we're ready to provide those needs. You also pointed out about skilled nursing facilities and nursing homes. Those are places that take care of some of our most vulnerable members in our communities. And they've been under the same duress, if not more. We've been working very hard to make sure that their staffing, their safety procedures, and how they deliver care, the accessibility to vaccines and to monoclonal antibodies, are as high as they can be to try to keep those facilities part of our chain of care.
Thank you. Next question, Paul Goff, Pittsburgh Business Times. Paul, please go ahead.
Hi, thank you very much for taking the time. I wanted to ask you about the status of the UPMC staff vaccinations, how that's going given the Supreme Court ruling, and what the next timeline is, and how many, what the percentage of employees have been vaccinated as of now.
So thanks, Paul. That's an excellent question. One of the things I'm most proud about is UPMC has had really fantastic results with our compliance. We've had our employees continue to embrace vaccination as we have used our own approaches prior to any mandates existing. Right now, we have 90% of our employees at UPMC who are compliant with the CMS mandate. We've used an approach that uses education of our employees, making vaccines accessible and easy to get to, and then having individual discussions to make sure that any concerns or hesitancy or resistance is something that we have dialogue about. We want everyone in our communities, particularly those who work together with us, to get vaccinated. The first deadline was actually the 28th of January, where CMS set certain thresholds. UPMC met those thresholds already. The next deadline will be February 28th. I'm comfortable that we will meet those deadlines again. We will comply, but we'll do this in a way where we engage with our employees and we deliver the performance that you're counting on, that we're counting on. We want everyone to be safe.
Okay. Thank you, Don. Next question, Holly Patterson from the Record Argus. Holly, please go ahead.
Good morning. I was curious curious to know if you are seeing more frequent pods of increased numbers of hospitalizations and infections in more of the rural areas versus more of the urban areas, and how those infections are relating throughout all of the ages, from birth through, the most elderly.
Throughout the entire pandemic, different segments of not only the UPMC communities, but the communities across the Commonwealth and across the country have had slightly different experiences with whatever version of the virus was present. And by different, I mean a different timing and pace. But what's consistent is that virtually every place where we serve and virtually everywhere around the Commonwealth and country has had exposure and activity from the virus, and particularly Omicron. There have been peaks and coming down, and those have changed over time. So nothing about that has really fundamentally changed. The declines that we're seeing at UPMC have been happening across all of our facilities, so it doesn't exclude, or it's not disproportionately represented in one area or another, and that's not a surprise to us. The other thing that has changed is that we have seen most recently a younger group of people that not only have a positive test, but need hospital care, and that includes our children. And in the beginning of the pandemic, you'll remember that that really wasn't as big of a concern. It's much more frequent now, and you might say, why? The virus changed, and our children, particularly those under 5, haven't had the capability to get vaccinated yet. We know that children often do better with Omicron, but they don't always do better. So this is still a real threat. Coupling that with people over the age of 12, particularly up through 60, if you've made the decision to not be vaccinated, you still have substantial risk from it. And we see more people in those younger to middle adult age groups who require care than we did compared to 3 or 6 months ago. It's another reason why, if you have any concerns about protecting yourself, vaccination is the smart choice.
So I would add on to that, Dawn's excellent points there, that, our hospitals that are within our rural communities also tend to be a little smaller. And so when we look at the capacity of those organizations, they've been really working very hard to take care of their communities, and they have been equally full and busy. And so I think it's also an important context to realize that there is differences in some ways geographically based on the amount of volume that we can handle. But they continue to see very large levels of activity that we're responding to on a day-to-day basis.
Thank you. Next question, David Winter, Harrisburg Patriot News. David, please go ahead.
Thank you. A few weeks ago, UPMC detailed the lottery system for distributing Evusheld. My question is, are you finding that a greater number than expected are not responding or haven't responded? Has it been harder to reach the people that you want to reach and get it to them in the order that you were hoping for? And have you had to change the plan as a result of that? Thank you.
That's an excellent question, and it's part of the reason why we're here today. As throughout the entire pandemic, there have been many new medications, treatments, and solutions that have come forth. And one of the things that UPMC has done so well is reaching out to the communities we serve to educate them about the importance of these strategies. And so we've only had 3 weeks of actually being able to engage in this messaging. And our lottery has been working very effectively as it relates to identifying those individuals that are most at risk. But we also are wanting to educate patients directly and our physicians about the importance of supporting the offering and the administration of this medication to our patients. And so we are holding our course and out promoting at every level, and believe that at moments like today, conferences like today, allow us to be able to pass that message even further and broader. I'm wondering if Dr. Marks might have a comment too from a physician caregiver perspective.
So really two approaches. One is we are trying to get the message out to our physicians to talk to patients ahead of time. And it's really important that our physicians, particularly those who are taking care of immunocompromised patients, get the message to these patients that they should, in fact, agree to get Evusheld when offered, and it's perfectly safe. The second approach we are taking, and I can tell you that personally, I've been telling my patients ahead of time that if you get the call from UPMC, say yes. If you're offered Evusheld, you should accept it. I think that a lot of patients are blindsided, as Tammy mentioned. They're not familiar with it, and their automatic reaction is to say no. But again, we've got to educate our docs, and we've got to give our patients a heads up before they're called. The other thing is Evusheld is only for immunocompromised patients. Everyone can't get Evusheld. It is only for immunocompromised patients over the age of 12, and we've actually set up a tier system so that in Tier 1 are the most immunocompromised, or patients who are at greater risk if they get COVID, who will be eligible to get the first doses of Evusheld.
Thank you. Next question, Emily Mullen, Pittsburgh Post-Gazette. Emily, please go ahead.
Hi, thank you so much for taking my question. You've answered a lot of them already, but I did have one remaining question that I don't think you addressed yet. You did mention that you recently received a larger supply of Evusheld. Do you expect to receive additional doses?
Again, excellent question. We find out week to week from the federal government and the state how much drug we actually do receive. And so we're hopeful that our doses will continue to increase and that we're able to get those doses in people's arms in our community.
We have one more question from Liz Kilmer of WPXI. Liz, please go ahead.
Hi, thank you. Real quickly, I just wanted to confirm. So people at this stage can't try to make appointments for this, right? It's just you're by tiers kind of contacting people. And then just really, really quickly, I've heard this therapeutic pronounced different in different ways throughout this conference, and I want to confirm it's Evusheld. Is that right? Thank you.
You picked up on
Yeah.
You're exactly right.
Yeah.
The temptation to say shield is very, very high, but it's Evusheld. You're exactly right. And you are correct. Right now, we are reaching out to people with the highest level of need for Evusheld. And you don't have to contact us. We will contact you. We're here today to say that when you get that contact, let's arrange for it and provide that protection for you. I hope that we evolve to a different state as we get through the highest need patients and we develop a better supply, that in fact we can mature our system. We're not there yet.
Okay, great. Thank you all. And that concludes the time we have allotted for today. In about 45 minutes, we will email media attendees a link to download high-definition footage of this entire press briefing, which we do encourage you to use in your news reports. Anyone with a follow-up question can contact UPMC Media Relations, and please remember to follow @UPMC News on Twitter for updates. Thank you very much.